And welcome back. I'm your host, Dr. Bob Lee. Our next guest joins us with a whole lot of information on enrollment for healthcare for the year 2019. Make sure you get covered. We want to get you covered like a blanket. We welcome Marjorie A. Cadogan, and she's the board of directors, and Patrizia Bernard, the community health worker at the Bronx Community Health Network. We welcome you guys to the show.
Thank you very much.
You like that? Get you covered like a blanket.
Yeah,
we use it all the time.
We're going to steal that from you. We're going to steal it.
Yeah. But then you got to make me some blankets so I can go around and cover people.
Okay. We'll have the BCHN blankets.
There you go. All right. So tell us, what do you have? Tell us
Well-
about some of the wonderful things that you're doing.
Well, BCHN is a wonderful organization in the Bronx. We're an innovative nonprofit that provides quality health care for Bronx residents all over the borough. We are federally funded and we operate 21 health centers. And beyond providing health care, we also provide a state-of-the-art community health and wellness program, of which Patrizia is a part. And we really try to meet not only healthcare needs, but a lot of the other social and local needs that really make living well possible.
And that's important.
Yeah.
Especially here in the Bronx, you hear so many, you hear about the statistics about people not eating healthy, not living right. And they said this is one of the places that's downhill in that category.
Well, unfortunately, we don't rank very well in terms of health statistics, but organizations like BCHN are really working hard to address that and to change that picture for the Bronx. And one of the things that is important for us to have people know, and that Patrizia will talk about, is the work we do with health insurance enrollment. We really want to make sure that Bronx residents know that even beyond December 15th, they can get health insurance.
Yeah, now, wait a minute. Because it's been all over the place that this is the last day for this and last day for that, but it goes beyond.
Yeah, well, because we, New York State, operate an independent exchange.
Gotcha.
New York State extends the open enrollment period to the end of January.
Why don't they say that?
Well,
Because then everybody says, all right, I lost my chance.
I mean, I think that New York State says that. I just think that there's a lot of confusion with the other states, and people kind of cannot make the difference.
Maybe they just generalize it.
They
Say
generalize
this is the
it,
last
correct.
day for enrollment.
In most states.
That's what you hear all over the place.
Correct.
This is the last day for enrollment.
and
but
that,
it's extended
yeah,
here.
Yes.
Yeah, that really is the deadline for the federal exchange, and many states are on that exchange, but we benefit from having our own.
Correct.
Got it.
So we want to remind all the viewers that if they still need to enroll into the marketplace, they can give us a call. They can call us at 929-220-8181, and we'll be happy to facilitate the enrollment for them.
Now, what has been cut out of it? They've been trying to cut the programs and all this stuff for many years now.
Yeah.
So I'll take a stab at that
Sure,
and I'll
go
let you go.
ahead.
They've been trying to, with the new administration, they've been trying to cut a lot of things and kind of repeal Obamacare. They're still working on that, obviously. This weekend, one judge in Texas actually struck Obamacare as being unconstitutional, and so that also creates a lot of
Supreme Court.
Correct,
Yeah.
but that's also creating a lot of confusion. But what we're here to say is that even if that is upheld, it's going to take a really long time. It has to go through a whole bunch of circuits. It has to go to the Supreme Court, and so for now, if people need insurance, they need to just continue enrolling. It provides services, and that's what they need
And it
to
still
do for
covers pre-existing.
Absolutely.
Talk about it.
The Affordable Care Act is the law of the land. That's what people need to know. Nothing has changed, even with the court decision. As Patrizia said, it's going to be a number of appeals before that has any impact on the operation of the law. And again, we have a wonderful platform in New York State with lots of different programs that are available for folks of variety of incomes, and folks just need to come and get it.
If it does change, how does that affect you guys?
Well, that's a good question.
I don't know if you thought about it.
I think if it does change, it makes our work even more important.
Yeah.
Because
That's
one, we
great.
have to see how it changes, what that means for the folks in the Bronx community, and then being able to translate and communicate that and educate folks about what still will be available to them and the things that they need to make decisions about.
Yeah.
Yeah.
And then the other thing that I would say is that also once we know how it will affect them, then it'll be up to BCHN and other organizations like us to find a way to kind of fill the gap in whatever way is possible.
So talk to our wonderful audience. You guys can take this camera right here and let them know that the deadline is not today or yesterday. It didn't pass. You can still register.
Absolutely. So, members of the Boogie Down Bronx,
Uh-oh.
know that December 15th is not your deadline. Your deadline is January 31st to get the kind of quality insurance and health care that's available to you in the Bronx. BCHN can help you. Our community health and wellness program with folks like Patrizia are out there working to connect you to the kind of coverage and care that you deserve. So please be in contact with us. And as I said, come and get it.
And call us. I'll just give the number again. It's 929-220-8181.
So you did not miss the deadline.
No,
You did not. You did not. You did not.
All right.
Not at
Where
all.
can we go for more information?
www.bchnhealth.org.
Yay.
Say it again.
www.bchnhealth.org.
Marjorie, Patrizia, thank you so much.
Thank you for having us.
You guys are doing great. Thank you for all the work that you're doing in the community. We love your service. Thank you so much.
Thank you.
All right, we have to take a quick break right here, but stay tuned. We'll be right back with more Open next.